All right, welcome. Today, we're diving into one of the most incredible transitions in human life, the journey a newborn takes in their first 24 hours. We're going to explore the absolutely critical nursing care that makes sure this journey starts off safe and sound. I mean, just think about the shift for a second. They go from this warm, dark, fluid-filled world where every single need is met automatically, to a world of air, gravity, and having to do everything for themselves. It's a massive physiological whirlwind. And for us as nurses, that means it's go time, a period of intense observation and critical action. So here's our game plan. We're going to start with the all-important golden hour. Then we'll jump into that first big assessment and all the essential care. After that, we'll learn how to decode what a newborn is telling us, and we'll wrap up with everything we need to teach parents before they go home. Okay, let's kick things off with the golden hour. These first 60 minutes of life are everything. It's where the most dramatic, most vital changes happen. It is a period of super fast stabilization, and what you do here really sets the stage for everything else, starting with that very first breath. You know, that first cry, it isn't just a sound, it's this monumental biological event. The sudden cold air, the shift in blood chemistry, and just the physical squeeze of birth, it all triggers the baby's brain to say, okay, time to breathe. And just like that, the lungs open up and life on the outside begins. In these first few seconds, our priorities are super precise, and they have to be in order. After the cord is clamped, we have to clear the airway. Now, this is a huge point. You always suction the mouth before the nose. Why? Because if you suction the nose first, the baby might gasp and inhale any fluid that's in their mouth. So mouth, then nose. Once that airway is clear, it's straight to the APGAR. The APGAR score gives us a really quick snapshot of how the baby is doing. We check it out 1 minute and again at 5 minutes after birth. If the score is 7 or higher by that 5-minute mark, that's a great sign the baby is stable. It's a simple way to remember what to check: appearance, pulse, grimace, activity, and respiration. So with that initial transition handled, we move into our first really comprehensive assessment. This is where we gather all the data that becomes the baseline for the baby's entire hospital stay. It's how we'll spot any little deviations from normal right away. These vital signs right here, they're going to be your guide for the next few hours. You'll notice the breathing rate is a pretty wide range. That's because shallow, irregular breathing is actually normal at this stage. We always take the heart rate apically. That means with a stethoscope on the chest for a full minute. And temperature is so important. A tiny drop can spiral into low blood sugar and breathing problems really fast. Okay, everyone, listen up. This is a major non-negotiable red flag. If you see that baby's chest or sternum sinking in every time they take a breath, that means they're working way too hard to breathe. It's a medical emergency, and you need to get help immediately. It's a classic sign their lungs are not adapting well. During a vaginal birth, the baby's head can come out looking a little, well, cone-shaped. It's totally normal, but it's really important to know the difference between these two things. The key thing to remember is this. A caput is just a spongy swelling that can cross the suture lines on the skull. But a cephalohematoma, that's a collection of blood that is stopped by those lines. It does not cross over. That's how you tell them apart. All right, now let's talk about being proactive. Beyond just assessing, our job is to give some key protective treatments. These are all designed to shield the newborn from common and totally preventable dangers that they're really vulnerable to in these first few hours and days. These 3 things are standard practice for very good reasons. Vitamin K is a big one because newborns don't have the gut bacteria to make it yet, and it's essential for blood clotting. Erythromycin ointment protects their eyes from nasty infections they could have picked up during birth, and the hepatitis B vaccine, that's their very first step towards a lifetime of immunity. So let's get specific on the nursing action here. The dose is tiny, but the impact is massive. We give it as an intramuscular injection, right into that big thigh muscle, the vastus lateralis, and we do it within the first hour of life. This one little shot prevents what could be a catastrophic bleeding disorder. Newborns are like tiny little space heaters that aren't very efficient yet. They can lose heat in 4 different ways: evaporation when they're wet, conduction if you put them on a cold surface, convection from drafts in the room, and radiation if they're near a cold window or wall. Our job is simple. Dry them off, warm up surfaces, block any drafts, and keep them away from cold spots. All right, now for a really fun part, learning to speak baby. They can't talk, obviously, but they are communicating with us constantly through their reflexes, their skin, and even their diapers. Our job is to become expert interpreters of all these little signs. You know when a baby startles at a loud noise? That's the Moro reflex. When they turn their head toward your finger when you touch their cheek, that's rooting. These aren't just cute little quirks. They're primitive reflexes that tell us their nervous system is wired up and working correctly. We check them to get a good neurological baseline. When it comes to jaundice, timing is everything. It's so important. A lot of babies get a little bit yellow after the first 24 hours. That's physiological jaundice, and it's just their new liver getting up to speed. But if you see that yellowing within the first 24 hours, that's a major red flag. It's pathological, and it has to be reported right away. What goes in must come out. And honestly, the progression of a baby's stool is a fantastic sign of how their GI tract is doing. It starts as that black, tarry meconium, then it transitions to a greenish yellow, and finally it becomes that classic yellow milk stool. This timeline tells us the baby's gut is adapting and digesting just like it should. Here is another critical number I need you to remember. 24. A healthy term newborn should urinate within the first 24 hours of life, period. If they don't, it could signal a problem with their kidneys or their hydration, and you need to let the provider know without any delay. So, the baby is stable. Our job's done, right? Nope, not even close. This is where we shift from being a clinician to being a teacher. It's one of our most important roles because we have to make sure parents have the confidence and the knowledge to take care of this tiny human at home. This is where we prevent future problems. These are the absolute non-negotiables we have to teach before they leave. The ABCs of safe sleep. Alone, on their back, in a crib. This is life-saving information. We'll also go over how to care for the cord stump, how to spot feeding cues, car seat safety, and the incredibly serious danger of shaken baby syndrome. Our teaching empowers them and keeps babies safe. I want to just pause here for a second because this is probably the single most important piece of safety advice we can give. The evidence is crystal clear. Putting a baby on their back to sleep on a firm surface with nothing else in it dramatically reduces the risk of sudden unexpected infant death. And, this really gets to the heart of newborn nursing. Of course, the clinical skills are vital. The assessments, the meds, the monitoring, but that human connection is just as critical. You are building a family's confidence at one of the most vulnerable and amazing times of their lives. So, as we wrap this up, I want to leave you with this thought. Nursing a newborn is this incredible blend of science and art. It's about knowing the numbers and the procedures, but it's also about calming a new parent's fears. Being the guardian of this transition is an awesome responsibility. Thanks for joining me.